Hello and welcome to my channel. This is the Age of Pandemic series. We have been under lockdown for several weeks now, and these long days and nights have made me wonder, where do I stand in the world today? What is waiting to happen to me? How am I going to navigate my ambitions and dreams in the coming years, possibly decades of pandemics? Not just the coronavirus, but also many more disasters caused by climate change. Will I have the job I dreamed of? Will I have a happy family life? Will there be holidays, picnics, movies, eating out? I wonder. I just don't know what the world will look like this time next year. Nobody knows. In many ways, we are back to the year 1347 when the Black Death pandemic hit. It lasted spells of 3 years, 5 years, and in some places for 15 years. And this went on for more than 300 years. I've been wondering about my own life so far. I was born in 1989. It was the year of Tiananmen Square, the year communism fell and the Cold War ended. I was full of hope growing up.
Our goal must be a world in which the trading system is open, where working people have hope, and where the world's environment is protected through policies that foster sustainable growth.
My parents were Cold War children. They dreamed of a life for me in a world of peace, prosperity, and global sharing of resources. But then, from the year 2003 onwards, there was one outbreak after the other.
Healthcare systems around the world are in crisis. The virus, still a mystery, has proven deadly. The Chinese doctor is dead. And soon more than 700 others will die of severe acute respiratory syndrome, SARS.
Until the big one right now.
WHO has been assessing this outbreak around the clock, and we're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction. We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
Breaking news. The Anthropocene age ends. The age of the pandemic begins. Now, what was the Anthropocene era? This is an informal way of describing the world as we knew it, when humans bossed over nature. That is until the coronavirus broke out in January 2020. Almost everything good or bad that happened up until the coronavirus pandemic was driven by human ingenuity, or the lack of it. But since the coronavirus has struck, we are already seeing things happen in response to these microbes, which are so small that you need an electron microscope just to see them.
This is SARS-CoV-2.
Almost every major city in the world is under lockdown. Big, powerful countries are using their diplomatic clout to deprive the not-so-powerful countries of medical equipment. And here are the well-known forms of human bad behavior: racism, discrimination, privilege, poverty and inequality. The global economy is collapsing. Vast sectors of the world's economy are expected to simply fold up. We are reminded of the 2008 recession and the 1930s Great Depression, and we're being warned that things will be much worse this time. Today I will focus on depression, not of the economic variety, but depression of the mind. Depression is a disease that cripples not only the mind, but also all the autoresponses and even muscle memories of humans. It kills. Depression can lead to suicide. It makes people want to shoot down 10 people at a bus station. Suicide, already the highest growing cause of death in many countries, may become the most common cause of death. Even high achievers who succumb to depression commit self-destructive acts. At the everyday level, depression causes trauma for not only the person suffering it, but also members of her family. Families break up, And most often, other family members become mentally unstable themselves. So, in a sense, depression can be contagious. Is depression treatable? Well, there are drugs and interventions, but they work only sometimes when the conditions around the patient support recovery. In many cultures, depression is not even recognized as a human condition. It is thought of as a luxury predicament. Recently, a film star said he didn't have the luxury of being depressed. That only shows how ignorant people's understanding of the disease is. People who consider themselves not depressed think of depression as an acquired syndrome. Well, if it is acquired, then the perfect conditions for acquiring depression have been created by the coronavirus pandemic. You can try to contain the coronavirus with face masks and use water and hand sanitizers and gloves to fight it. But what can you do when you are depressed and everybody around you is too caught up with the problems created by the pandemic? As it is, there are very few doctors who are specialized to treat depression. Governments everywhere have pitifully inadequate infrastructure to research and treat depression. We millennials are already a battered generation thanks to many social, political, and economic factors. And now we are on the brink of a psychological washout. At the prime of our lives, we are suddenly faced with the prospect of unemployment because the coronavirus is likely to cause the biggest economic collapse since the 1930s. A lot of articles have started appearing predicting that entire sectors of the world economy will vanish. I have added some links to these articles in the description box below for you to read. Today, information on the state of the world is available for free through your smartphones. This is one great advantage that we have over our counterparts in the 1930s. Please read. However, there is a flip side to having information. What happens when you know what is to be known but are totally powerless to change things? How will you be comforted knowing that you are just a statistic? You may have just finished college. Your parents may have taken out a huge loan expecting that you will earn in 6 figures and be able to pay off that loan. But today, you realize that your degree is worthless because the industry you wanted to make a career out of has vanished. You are just one out of 500 million professionals of your specialization worldwide whose offices or factories will never open. Do you think the banks will forgive your loan? Or will they hound you as they are too scared to upset the few economic sectors that are surviving? The mental health of citizens is vital for any economy hoping to recover from the pandemic. But societies and governments have for years been ignoring this aspect. My generation was impacted strongly by the 2008 recession. Countless were psychologically damaged forever after suffering home loss, education interruption, and witnessing their parents' trauma firsthand. But our governments and the wise people were only interested in the macro revival of the economies. We were so young and inarticulate that we failed to register our protest. But will we do better this time? People are already saying things like it is better to die than live like this. I am very worried that thoughts like these are traveling freely all over social media. It would be a great calamity if young people in the prime of their lives begin to harbor and spread such feelings. I hope that through my channel, I am able to marshal impulses to awaken governments and civil societies in the free world so that safety nets can be laid out for the most vulnerable victims of the age of the pandemic, the millennials. Please subscribe to my channel and do click on the bell icon so that you don't miss a new post. I'll be back in a few days with a new video and I'll be focusing on the twin blows of the economic washout and the complete erosion of the hard-won rights of women in the age of pandemic. Thank you.